We haven't had a discussion at this point of having an alternate contact number specifically for Portland Street response.
And can people self-refer?
I'm sorry?
Can individuals experiencing a crisis refer themselves?
Yeah, I imagine that that will happen down the road. I know that does happen in Eugene and Springfield.
And I'm sorry if someone already covered this, I didn't hear it. What will the team be doing in between calls?
I personally believe they're going to be very busy, and they're going to be going from call to call. You know, the model is that if they're driving around and they're not on a call for service, they're probably going to find something that they can self-dispatch on.
And then calls outside of service hours will just be routed to fire or police like they are now, or?
Yeah, that's correct.
Okay, thank you.
Commissioner Fritz.
Thank you very much for the presentation. Thank you, Commissioner Hardestino and your staff for all this work, and thank you for your great partnership with Street Routes and also with Portland State. Why will this team be based at Station 1 instead of Station 11? I thought it said that they
Physically, Station 1.
So our data analysts, when we looked at our response and call volume, we offered multiple locations based on the population. And a recommendation for station downtown in the core, but that's where all the resources are. We also know that we have vulnerable populations and houseless out in Lentz, East County, and so we wanted to see within the pilot program what the turnaround would be and how effective the pilot would be when you're further removed from resources.
So I understand why the Fire Management Area 11 has been chosen, but I thought the report said that the staff are going to be based in Station 1.
It does say that, maybe it's just a typo though.
So when they show up to work in the morning, they'll be at Station 11.
So when they show up in the morning for work, they report to the main headquarters.
So
And
that's my
they will
question.
be
Why are they doing that?
mobile.
My office is at Station 1. All of our admin duties that would not be covered in the mobile, in the field, would be conducted when we return back to the admin station at Station 1. That's my current office. This is going to be a pilot through the 40-hour work week schedule, so that's really what it is. Once we've established that the pilot is successful and we look to expand, then we would probably consider at that time where we need stationing or housing those vehicles to respond 24/7. But right now we're not doing 24/7 response simply because we're matching the current work schedule that I have now.
Yeah, it just seems that that's a lot of travel time to keep starting off at downtown and then traveling out to Lentz and back.
And this is not set in stone. We also have a location, 122nd, in Sandy, our training center also, that if this mobile team needs to do administrative stuff, they can use a closer location.
Okay, great, thank you. I appreciated you giving the actual data from the survey that the Street Routes folks worked on, and it showed, understandably, that mental health professionals are the #1 desired people to respond, which, as a retired psychiatrist, I certainly agree with that. It has emergency medical technicians as also one of the top 4, but it has firefighters as the bottom one. And so, and then it also talks about what should the uniform be. And I know that maybe you haven't got that as far down the line, but how are we going to, if they're coming in a red fire truck with sirens, even if they don't use them, how are we going to make it clear that this is a medical person and not a firefighter?
I'll jump in for a moment and just say that I think that data did show that a firefighter showing up in firefighter uniform with a fire truck is not the right response. But in terms of Portland Fire and Rescue using an infrastructure to then have people show up as a medic and a crisis worker, to me that does feel very different. And in terms of the survey, making clear that people do need to have a very different uniform, I think that's very important.
So that can be figured out as you actually implement what that looks like. Because I noticed in the video of the Cahoots folks, they both look very much dressed down. Thank you. And then my final question is, what's the process for completing the pilot, getting information back to council, making decisions as to what the next steps are?
We are, as Greg mentioned, we're planning to report to council 6 months from when the unit is actually operational in FMA 11, and then set an evaluation calendar internally and with council after that. But we're going to wait 6 months to where we actually have some good data. And I believe in the 1-year checkpoint is a whole other evaluation. So really the formal part of that is every 6 months with council. We've been discussing internally that we're going to need a monthly with all the partners, including community stakeholders as well, because as you know from today and what I said at the outset, there's going to be a lot of learning that's going on, and we want the flexibility. And I think that what the Kai used was, the admonishing us not to be rigid. We want to be flexible and make changes as we go along.
Thank you. So then the 500,000 that we allocated in the last budget, presumably not going to be spending that much in the next 6 months, and so that would carry over to complete the pilot, and then you would come back in 2021, 22 with funding requests.
I was just gonna, excuse me, I was just gonna say, we haven't thought about what the next funding request will be, so I don't want us to be on the record to say we're not coming back until 2021. We may come back next year as part of the budget process to talk about expanding the pilot out, and so we just haven't made that decision yet.
Well, that's kind of my point, is that we won't be starting by the time we're doing the budget. So I want to make sure that we have information before we decide what the next steps are.
As do I.
Exactly. I just have one more question and a comment. I'll throw this out for anybody. In talking to the people at Cahoots, one of the problems that they continue to run into, even to this day, is the lack of other community support mechanisms. In other words, if they have somebody and they need to get them into housing, the housing's not necessarily there. If they need to get them into mental health services, the mental health capacity isn't necessarily there. If they have somebody who is ready for addiction treatment, there's not necessarily a treatment bed available. What is the current status, and what is the plan with regard to working with all of our other nonprofit and agency partners to figure out the seamless transition into those services?
I can tell you there that next month, we're going to meet with the healthcare providers and mental health providers as a collective group to basically inventory what services are out there. If you talk to folks today, most people just don't know who does what and how you connect to them. So there's also the Montgomery County 24-hour day mental health number that most people don't know, the 503-944-4444 number, I think. But again, I mean, we have a lot of resources that people just don't know how to connect to. So I don't know the answer to that question today, but as we continue to build the pilot, we will have more information about how to connect people to services that exist. I also want to be very clear, in no way do we want to recreate the wheel. We don't anticipate the Portland Street Response Team either developing mental health services or housing services or anything that's outside of our field of influence. The goal is to connect people to services that exist and do the best we can to keep people out of harm's way until we can do something better.
Yeah, that's well received, Commissioner, and I appreciate that. I see some opportunities here, I think, for collaboration with some existing platforms that are out there. I had a chance to coincidentally meet with Steve Allen from OHA, Oregon Health Authority, today, and much of our conversation centered around the needs in communities for addiction treatment, mental health services, crisis intervention, and how we can potentially better collaborate with the state's efforts. Mention was made of the Governor's Task Force on Mental Health and some of the strategies they're going to be bringing forward, and we should be part of that process. Sharon Myron, over County Commissioner Sharon Myron, is doing her baseline assessment of where we are with mental health services and crisis services in the community. And in a really interesting way, all these pieces are starting to come together. And I think this is one more node or leveraging point for all of us. Tom, you have
Yeah, Mayor, one comment on that. I want to applaud the Fire Bureau for already thinking about coordinated care organizations and other potential partnerships. I was in one meeting in which it was clear to me that there's been a lot of thought around the data that we collect and the case that we put together is critical for next conversations. And we know a lot anecdotally, but we don't know enough to actually approach potential partners with partnerships. So we are going to be very aware of that list and who we should be talking to next. And I think that a lot of good thinking is already going on around that.
Yeah, my point is really those tables are set, and we should join those tables rather than trying to reconvene additional tables.
Agreed.
Unless it's necessary. In some cases, it might be absolutely necessary. Then just a comment, as I'm listening to the testimony, I want to make sure that we give due accolades to our existing first responders, both in the Fire Bureau and in the Police Bureau. And I want to be very clear that there are people who are trained and highly effective in crisis intervention and crisis management currently in the Police Bureau and in the Fire Bureau. Quick story. Just earlier this week, the Police Bureau and the Fire Bureau intervened in a very serious crisis intervention situation. It's one that probably would not have gone to a street response because there was, as I understand it, a weapon involved. But the individual was in a heightened state of crisis. The individual was well known to the people in the community, and they did, in my opinion, a masterful job of de-escalating that situation and resolving that situation. So I don't want any of our firefighters or any of our police officers who are listening to this to think in any way this is a judgment on them. This is not about personnel. This is about refining a system so that it better responds to the needs of the community. And I just wanted to make that point crystal clear. Commissioner Hardison, you want to wrap this up? And I believe since we have to adjourn for 15 minutes until our next item, just time certain.
Can I make one point, Commissioner, before you make your final comments? I want to reiterate to people that didn't see, we have evaluation cards, unasked questions circulating in the chambers. Please, if you don't have one and you want to add a question or make a comment, please grab it. We want to reiterate, we're going to be learning in this process and we value the engagement.
Very good. I'll entertain a motion to accept the report.
So moved.
Second.
We have a motion from Commissioner Hardison, a second from Commissioner Daly. Any further discussion? Call the roll.
Well, look at what can happen when we bring everyone together around the same table. This is amazing. Oh my gosh, did I get 12 fingers in there?
I made sure that the video feed was not on tape.
One of you wants to go. So, this program is desperately needed and has been for decades. The federal government is chronically underfunding affordable housing, mental health care, and addiction services.